Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Welcome to another episode of the WOW MD podcast. In the previous episode, I discussed and reviewed the 4 key body systems we need to preserve as we age. I would like to quickly recap those 4 body systems. Number 1, our brain. We need to preserve our brain as we age. This implies maintaining mental clarity and maintaining and preserving an optimal positive mood. Number 2, our eyesight. We need vision in order to lead a normal life. This involves our eyesight and our eyes, as well as our optic pathways to the brain. Number 3, our musculoskeletal system, which gives us our mobility. That involves our bones, our joints, and our muscles. And last but not least, number 4, our heart and cardiovascular system, because we need oxygen carrying capacity that's represented by the heart's pump action, spreading our nourishing oxygen carrying blood to all of our tissues throughout our blood vessels, which need to remain open and flexible, not stiff. And our heart pump action also is pushing carbon dioxide containing blood to the lungs for oxygenation, while nourishing all our elimination organs like the kidneys, the intestines, and the skin, helping them eliminate byproducts of metabolism and toxic products. One key body system I did not quite touch upon in the last podcast, but I did discuss it in the previous 2 episodes that referred to the autoimmunity and whether or not this is our new epidemic, is our immune system. As you know, we live in a toxic world. We are constantly exposed to all kinds of radiation, from cosmic radiation to electromagnetic and radiomagnetic frequencies, and we are surrounded and constantly under attack by a multitude of infectious pathogens, viruses, bacteria, parasites, etc. It goes without saying that an intact and healthy immune system is crucial as we age. What is not talked about a lot is the fact that cancer is most likely an aging disease. So I'm going to repeat that. Cancer, it's a disease of aging. Most likely one of the major reasons the risk for breast cancer, prostate cancer, and other cancers goes up significantly as we age is because these types of cancers are really degenerative diseases that accompany our aging. What you should know, and it's well-established fact, is that our immune cells will get older and much less capable of defending us past our 6th or 7th decade. There is a reason why the CDC recommends significant vaccinations like the flu, pneumonia, shingles, and COVID, and more for the elderly, because they are frailer and their immune system is significantly weaker. Unfortunately, what is also common knowledge, but much less talked about, is the fact that the capacity to mount an immune response is significantly lowered in the elderly. Again, our immune system is bound to fall prey to the same problem all our other systems fall prey to, which is aging. And our immune system aging will be accompanied by varying degrees of dysfunctionality, which is something to watch for and something that needs to be addressed. So we reviewed the major key systems that we want to preserve as we age. So my next question, and it's something that I think you should ask yourself, when should you consider an anti-aging lifestyle or anti-aging therapies or interventions? That is a great question in my mind, as I'm 56, almost 56, and I wish many of you would start asking early on. The truth is, the majority of people are concerned with anti-aging once they start looking in the mirror in their late 40s or early 50s and notice significant changes. Stuff that wasn't there before. Wrinkles, laxity, lower face falling, receding hairline, hairs on the face where they didn't used to be, bulges in some areas of the body where they didn't used to be, etc. What is also unfortunate is that many do not understand that anti-aging is really not about preserving your looks, but is mainly about preserving your health, and specifically about preserving our functional capacity as we age. You probably will agree with me when I say that looks don't matter if you don't know where you are or who you are. Being pretty and aging well in an aesthetic sense doesn't matter if you can't move and you're bedridden. So coming back to my question, when should we start worrying about aging? Ideally, as early as our 30s. That would be a very proactive approach. Worrying about anti-aging in your 30s would involve advanced knowledge of how the body works and what do we need to keep our body optimally healthy past our 5th decade, when most of the aging changes are noticeable. So, talking about advanced knowledge of how the body works and what do we need to do to keep it healthy, here comes this podcast, this episode, and there are probably many other resources out there, other podcasts, information on the World Wide Web, etc. Hopefully, your doctor is a wealth of knowledge and information, but if he or she isn't, then please make sure you got a doctor on your team that cares about anti-aging, who doesn't tell you, oh, it's normal, you're just getting older. It's normal. Yes, getting older is normal, but allowing your body to slip down the path of irreversible changes that would lead to capacity loss, to function loss, that is not normal. So let's start thinking about anti-aging in our 40s, ideally no later than our 50s. Well, you might be in your 60s and 70s, maybe older, and listening to this podcast and wondering, am I too late? The answer is never too late. Let me give you the best example for that. That's of my mother. She was 72 at the time when I got really interested in anti-aging. And my only interest in anti-aging was mainly for her benefit. And what became a desire to know what the heck is anti-aging medicine in 2011, when my father passed away, it turned into a passion to know more and more. And then I wanted to apply it to my practice because anti-aging medicine is common sense medicine. Good news, my mother just turned 87 last week, and she is going strong. Of course, I wish her dental health, joint health, her vision and brain health would be better, considering the fact that she's able to do a lot of brain functions, like manage a Facebook account, learn how to use an iPad and an iPhone in her late 70s, and use WhatsApp successfully, something that I learned to use after she knew how to use it and was already using it. Considering the fact that she lives by herself in Romania and travels across the ocean 2 times a year by herself, I would say she's doing pretty well. As far as her vision, of course, she will need cataract surgery, which we're planning to do for both eyes in the next couple of months. And as far as her musculoskeletal function, I constantly work with her using all my anti-aging devices including my ViaSure shockwave therapy and my biophotomodulation photona to help relieve her joint pain and swelling in her knees or her shoulders or the small joints in her fingers and hands. I could also talk about my mom's anti-aging regimen for a while. That would take the rest of the podcast. Instead, I'm going to focus on giving you some pointers on what are the main things you should focus on in your own personal anti-aging journey. First of all, remember that it is never too late to apply anti-aging principles and use anti-aging therapies to improve your health. So coming back to the when and the how. Most men and women are concerned with aging in their 40s, maybe 50s if they're lucky, when they first notice a drop in their energy, a change in their mood, a change in their weight, especially when they cannot keep the weight off, or when they notice a disturbance in their sleep, or a change in the desire for intimacy. So what specifically triggers those first major changes in our health and our well-being that now prompt us to notice this loss of energy, the poor mood, the disturbed sleep, the loss of interest in being intimate, the skin changes, the decline in stamina and endurance, the loss of motivation to be active, and last but not least, what specifically triggers significant weight gain as we get older? So the question is, do you know what key factor specifically declines as we age past our third and fourth decade of life? And what is this key factor's role in our wellness and survival? So I'm not going to keep you hanging. I'm going to give you the answer. And you might know the answer already because every single symptom that I described pertains to a major drop in, yes, you are right, a decline in our major sex hormones. The decline in estrogen, progesterone, and testosterone in women, and the decline of testosterone in men starts off a chain of events that involves other hormones, cortisol, thyroid, and insulin. It's a given that our growth hormone declines with age. And this is a crucial anti-aging hormone. And of course, promoting healthy growth hormone production is one of the key interventions in aging gracefully and maintaining optimal function. So we got the decline in sex hormones. We got the decline in growth hormone. Those are not the only hormones that become a problem as we age. What is very true, and you definitely should know that, and you might have a suspicion, is that a huge number of women have significant thyroid deficiencies as they age. Many women suffer from thyroid dysfunction past their third decade, and many men and women suffer from adrenal imbalance, usually known as adrenal fatigue. That's too much or too little cortisol, which can cause major issues and affects everything, including our sex hormones, insulin, thyroid, etc. Everything in the body is connected. And the truth is we age, we lose our sex hormones, our growth hormone starts declining, our cortisol starts going up, our thyroid becomes dysfunctional. But what is interesting is that if we replenish our sex hormones or replace them or optimize them, I'll get more into it later about the specific terms. But if we do bring back our sex hormones, that can help adrenal fatigue recovery. It can help us manage thyroid dysfunction so much better. It can help balance and make up for the loss of growth hormone as we age. Again, everything in the body is connected. And coming back to our sex hormones, the truth is, as soon as we lose them, we will notice those major changes I mentioned that qualify as aging. Of course, the most visible changes would be our new wrinkles, new excess fat in places we never had before. We now have bad nights with poor sleep. We might notice bouts of anxiety, alternating with bouts of depression or low mood, with occasional or frequent outbursts of frustration or anger due to new onset irritability. We might notice that mental clarity is not what it used to be. We now need lists. We don't always remember people's names. You might have noticed issues with recall of words or names, or simply put, it's become harder and harder to focus and retain new information. You might have noticed sex is different. The desire for it is much lower or completely absent. And you might have noticed the ability to enjoy sex is diminishing the deeper into our 50s and beyond we get. Women are innately strong. We women put up with a lot before we decide to do anything for ourselves. We always put other people first. Family first, career first, household chores first. Then we come last. In reality, it should be the other way around. Because if you do not put yourself first at some point, especially where your health is concerned or your optimal function is concerned, then your ability to be a good spouse, a good daughter, a good parent, a good mother, a good sister, your ability to do your job well might be significantly impaired by these health changes that I mentioned. Men simply hate going to the doctor. They think they're strong and manly, and there's nothing wrong with them. At least 50% of men visit a physician only at the urging or encouragement of their spouse or life partner. What you should know is that waiting a decade or more to address these changes can and will have significant consequences for your health, because some of the changes that occur in our bodies will be irreversible at some point or very difficult and hard to reverse. Please know that the decline in our sex hormones, the complete loss of our sex hormones, is perceived by our body as a major stressor. I mentioned this before in previous podcasts, and I will mention it again and again as this is a crucial phenomenon. As our sex hormones decline and are lost completely, the body perceives this as a stressor, and our cortisol production will go up. These two hormones are completely different in their action on our metabolism. Our sex hormones are anabolic hormones promoting growth and repair and regeneration, whereas cortisol, the adrenal hormone, is a catabolic hormone promoting and causing loss of muscle and bone. The imbalance created by the loss of our anabolic hormones, specifically our sex hormones, and the subsequent increase in cortisol due to the stress created by the loss of sex hormones will lead to excess fat, will lead to loss of muscle mass, creating insulin resistance and leading to almost impossible to lose, possibly irreversible weight gain. I hate to be the harbinger of doom, but it is a downward spiral, and it all starts with low sex hormones. It is extremely easy to fix hormone deficiencies. We simply replace them. Hormone replacement therapy is a very broad term that technically refers to thyroid replacement, adrenal replacement, sex hormone replacement, insulin replacement for type 1 diabetes. However, in layman terms, when we say hormone replacement therapy, the majority of people immediately think of sex hormone replacement therapy, which is estrogen and progesterone in women, or estrogen, testosterone, and progesterone in women, and testosterone replacement in men. What you should know is that hormone replacement is the best anti-aging tool that we have in our toolbox. And please remember this. I will in the future dedicate a podcast about the safety of sex hormone replacement therapy, because there is a lot of misconception and misinformation that our God-given sex hormones will give us cancer if we use them past menopause. That is not true. So please stay tuned for that. I have dedicated a very large number of my previous podcast episodes to sex hormones and sex hormone replacement. All you have to do is go back, and pretty much the month of October 2023, it's all dedicated to menopause and menopause hormone replacement. There is a lot of information provided for you, for your benefit, that is now at your fingertips in order for you to make an informed, educated decision on whether or not this type of hormone replacement therapy might be useful to you. Fixing and replacing hormones is not difficult. We have lots of options: compounded, bioidentical, synthetic, FDA approved, etc. What is difficult and very, very hard is fixing broken receptors, specifically broken hormone receptors, which is what happens when we develop insulin resistance, thyroid resistance, or mitochondrial dysfunction. Please consider this when deciding to procrastinate and delay sex hormone replacement. It is a very well-known fact that the earlier sex hormone replacement is initiated, the better for optimal function preservation, and the less likely we are to experience significant irreversible changes in our brain health, vision, musculoskeletal, and cardiovascular health. What you should know about our sex hormones is that they are part of the foundation of our foundation. They are our building blocks. They help us restore and regenerate most of our tissues: skin, bones, muscle, brain cells, etc. Our sex hormones keep us strong, agile, motivated, optimistic, and mentally clear. What you might not know, and what I want you to take away from this podcast episode, is that our sex hormones help us recover from adrenal fatigue. Who hasn't heard of adrenal fatigue? As we get older, more and more of us suffer from adrenal dysfunction. That means either we have too much cortisol in the evening or not enough cortisol in the morning when we wake up. The result is feeling fatigued and constantly tired with low energy, but being unable to sleep at night. Or if we do fall asleep easily at night, we wake up quickly after a few hours, and then we're not able to fall asleep again. We toss and turn until early morning, when we fall asleep exhausted. Shortly after, the alarm rings. Here's a new day, but instead of waking up refreshed, energized, and ready to start the day, we are dragging and require lots of coffee to get going. Please note that adrenal fatigue does not discriminate by age. Anyone of any age could suffer from adrenal fatigue. This is another topic for another podcast. But what you should know is that should you suffer from adrenal fatigue when you are also experiencing sex hormone deficiency, and on top of all that, your body's now 4, 5, or 6 decades old, your ability to recover from adrenal fatigue will be significantly impaired. Remember when you were young, we were all there. I'm talking about the 20s, maybe your 30s, when you partied like crazy all weekend, starting Friday afternoon, going late into Sunday night sometimes. But then come Monday morning, you would wake up, you were refreshed, energized, and ready to start a new week. Now, as we get older, we go to bed early. We are exhausted by 9 to 10 p.m. If you are over 40 or 50 and decide to stay up late or party one night like you used to, there is no chance that you are going to wake up refreshed, energized, and ready to start the day like you used to when you were younger. Part of the reason for that is that now in your 40s and 50s, you are missing your sex hormones. Even if they are being replaced, you're like, well, wait a minute, I'm actually using sex hormones. But you still feel that way. That's because your sex hormones or your hormones that are being replaced, including thyroid, are not optimized. As I'm approaching the end of this episode, what I want you to know is that there is a huge difference between hormone replacement and hormone optimization. Any medical doctor, and apparently any naturopath, can prescribe sex hormone replacement. But not all of them are trained and experienced in hormone optimization. Let's talk about that for just 1 second. Let me ask you a question. Are hormone levels important, Of course, they are very important. If your estrogen used to be between 150 and 250, so it's 150 or 250, somewhere in there, in your 20s and 30s, how do you think you are going to feel when your estrogen is now below 50 in your 50s and beyond? The answer is not good. If you're a woman and your testosterone used to be between 50 and 100 when you were younger and healthy, how do you think you will feel when your testosterone is now under 30? The answer is not good. If you are a man and your testosterone used to be close to 1,000 or more when you were younger and healthy, how do you think you are going to feel when your testosterone dips below 500? The answer is not good. Many physicians simply prescribe hormones and don't even bother checking hormone levels. Please know that is not hormone replacement, and it certainly is not hormone optimization. I could go on for a while on this subject, but I think I made my point, and hopefully I opened your mind to this key concept, hormone optimization. So to sum it up, as we age, number one, we lose our sex hormones. Number two, we make more cortisol. Number three, we either become or are more prone to be insulin resistant. Number four, we become growth hormone deficient. Number five, we are more prone to infections and cancer as our immune system ages. And number six, our ability to heal and repair declines. What you need to know is that some of these changes are easily reversible if we decide to intervene early on. If not, some of these changes cannot be reversed. They might be irreversible. They might be part of natural aging. Everything I mentioned can be managed and slowed down. So if you take anything home from listening to this podcast episode, please remember this. Our hormone optimization is a very useful tool and is key to an effective anti-aging protocol. I promise I will come back to anti-aging, and I will talk more about what it means to live an anti-aging holistic lifestyle. I will come back and discuss peptide therapy, the role of growth hormone replacement versus optimization. So please stay tuned. If the information provided in this episode resonates with you, please know that I'm here to support you, and I'll be happy to help you on your path to hormone optimization rather than simply replacing your hormones, whether we are talking about sex hormones, thyroid, or adrenal optimization. You can easily make an appointment with me or connect with my staff if you have any questions by going to our website, www.herabeautyandwellness.com. Until I see you again next week. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.